Unless you, I thought I was late.
Nope.
You guys got it?
Yep, we're good. Look, the lights just turned on, so.
They have all the strict somewhere.
Yeah, I don't know.
Does that change from the one that I sent myself yesterday?
And then I want to start with.
I think I signed it.
That is amazing.
Sunshine.
So, the ones from yesterday.
Yeah, what I want is the one. What I want is one so, yeah.
Right.
You didn't go to the game.
I didn't. Oh, how was it?
You said it was nice.
It's not just that. My pump malfunctioned overnight, so my blood sugar was really high, and now it just tanked. So
Okay, do you
I'm not
need
feeling too
something?
well. I'm gonna go lay down.
I think that's probably for the best.
I got this. You love
Did
it.
anyone else go to the gala?
Yeah, I left London.
Sorry, just you. You were the only one.
I was the last one there. It was a mess. We were supposed to be out at 7. We got out at 8:45. Cold.
How do I get that?
Okay, why don't you go lay down? Is that not out there? Everything there? I have some fruit strips and stuff. Yeah.
Can I just have one? Because I realized I'm almost out of sugar now. Oh yeah, it's up there. It's just hard to see. Just one. I've got food and all. I just don't really have a lot of sugar right now. Perfect. That's okay. Thank you so much.
Oh, I have some chocolate.
I never have anything sugary.
I know.
No, I was gonna say,
I'm
it's the worst
like,
school to be diabetic.
Yeah.
Yeah, I don't even, that was probably just like a random one of, like, this looks good. I'll be back.
Did you want to put
Please
the
go
new one
rest.
up?
Well, you it's like
Oh, yeah, I'll be fine.
Do you want to put the new one up? I just emailed it.
we'll go.
It's more late.
Later, because I want to do the girls' work.
We'll just, Kayla, yeah, we'll go check on her. Okay. Are these anyone's class?
I don't know. Yes.
Oh, okay. I just wanted to make sure that you needed them.
6 pair.
Floating around.
There's always a pair somewhere. And I don't always need them, it's late. Okay. That's supposed to be somehow that. I don't know, why did it slide, why, when you move slides around, sometimes the editing you did gets reversed. Does anybody know?
It's because the program's different. Like you're using a Mac program to Microsoft. like converting it to my
Even
position.
using it on my Mac, where I convert it, like if I duplicate it.
Yeah, but it's still, like, PowerPoint's still a PC program,
Yeah,
so it's not the same as the numbers and whatever the PowerPoint things
Well,
you're using.
These were all made on PowerPoint, and then I've been editing it for years on my Mac.
Yeah, but you use the other one, what's it called? Yeah,
Keynote. I
Keynote.
use Keynote.
Those aren't compatible, that's why.
But it works, but then if I copy them or I duplicate it, then somehow the editing
Yeah.
goes back, and it's kind of crazy.
It's annoying.
I have slides from 15 years ago that are actually much better, but they're Canadian. So, anybody go to the gala? Nobody went to the gala, so people who went to the gala may not show up.
Probably that.
So I want to start this morning with something rather active. We're going to do some more gait stuff. And last time we watched each other walk, and we learned how to evaluate some of the basic stuff that you look for when someone's walking. But we're going to use a muscle test that we've learned last session and this session, mainly last session, to evaluate gait from a neurological point of view. So we're always talking about muscles turning on, but muscles have to turn off. It's equally important that they turn off at the right time too. So if muscles didn't turn off, we wouldn't be able to walk. Don't do anything. So there's normal patterns of inhibition that go on when we're doing certain tasks. If you watch a child learning to walk, one of the hardest things for them is they can't, their inhibition, their facilitation inhibition patterns aren't developed yet. And so they can't turn muscles off, so they're just kind of like this, you know. And then you look at folks like, I've had over the years a number of patients with Parkinson's and things like that, and they have, one of the signature things with Parkinson's is they can't inhibit muscle function. So they end up just kind of locked, like you can't pick up your arm if the tricep doesn't inhibit. The bicep has to facilitate, of course, but the tricep has to inhibit. And in order for us to step forward, the left psoas and left rectus has to inhibit to allow gait, as well as the right psoas and rectus facilitate. And on it goes. So we're gonna, I'll show you here in a second, and we're all gonna do it. If I step forward with my right foot, my right upper trap has to inhibit, right? Unless I'm walking like this, if I'm taking a normal gait step, this upper trap has to inhibit to allow my shoulder to come back. Also, this pec has to inhibit my shoulder. There's a whole bunch of things that have to turn off to allow this to happen. This lat has to turn off to allow my forward arm swing. This psoas has to turn off. This piriformis has to turn off, has to inhibit, to allow forward flexion on the right side. So we're going to test upper trap, lat, and an SCM. So just always teach this with the right leg forward. Then of course left leg forward is the opposite, or just like a mirror image. So if I'm right leg forward, my right glute max, my right piriformis has to inhibit. My right upper trap has to inhibit. And my left SCM has to inhibit to allow this motion that we talked about in gait. It's so important where the head is going this way and this part of the torso is moving like this. To allow this to happen, this SCM has to turn off. Allow that to happen. The SCM does this. And you watch people walk and you'll start seeing things where they kind of walk like this, or they're walking like this. You start testing them, and there's all kinds of stuff not turning off. A lot of times the upper trap isn't turning off like it should. So they end up walking like this. And like that's one of the things that contributes to this kind of locking here, and then people just end up moving their arms like this. So somebody who feels pretty good this morning. I use you as a test subject. Maybe he's feeling kind of frisky. Yeah. Maybe you have a chance to do some exercise or go for a walk or something. And, you know, you didn't go to the game.
I did,
Oh, you did?
but
I heard there was problems with food, getting there on time, so everybody, and the open bar, the combination of the open bar and no food, led to some, lots of fights, I guess, broke out.
No, we're just yeah. So Chris, I don't know.
Nature pass, they get to drink and they go for fight.
Well, right, you got it.
Get on the fights. I grew up in a really small town in Eastern Oregon, and we used to have these, we had a city hall that was mainly used for dances. Then we played basketball in it too in the wintertime, but about once a month in the winter, they'd have these dances, and they'd have a live country band, and it was a big deal. And they couldn't allow alcohol, didn't have a license to allow alcohol inside, so all the adults would go out to the cars when the band took a break and drink whiskey and whatnot, and us kids had to stay inside. We're supposed to anyway, but we'd sneak out to see, you know. Anyway, there was almost every dance there was a fight, at least one fight. And it was usually some old grievance, you know, locals that, you know, they had, you know, history, and then they'd get to drinking, and or it would be, somebody would be just a little too friendly with another one's wife, and it was great. And then for the next month, everybody would talk in town would talk about what happened at the dance until we had another dance. So my folks weren't big drinkers, but Lynn. Okay, so I'm going to test. Tell me what I'm testing. And what am I finding? They're inhibited. They're not facilitated. Okay. Over all turn this way. First now, what am I testing? SCM. But now, what am I testing here? Okay. SCM. And these seem to be pretty good. Now bring this shoulder up. Slightly turns away. What am I testing now? And this way. When you test this, the easiest thing to do is to put your hand there first, then have them lift the shoulder. And then otherwise you do that, and then you're trying to fish your hand in there just a little. Now, you're not a good candidate for this. You're a good candidate for some other stuff.
Okay.
Take my hair
Okay, so you got, there's
Yeah.
stuff, yeah. So, yeah, somebody else, yeah. You're gonna be a good candidate for the next thing we're talking about,
Okay.
I think. So how are you feeling this morning? Pretty good. Elbow straight. So that's pretty good, huh? Pull in. Took up some slack there. Your shoulder comes up and hold there. Okay, that's good. Bring this up. And forward and turn. And away. Now, a guy this strong, I would almost want to come over in front and test it this way. This is a much more biomechanic and efficient way. If he was any taller, want to maybe get up on something. I mean, there's nothing wrong with having a little raised plank or step stool in your office. So, okay, so I'm going to have you step forward with your right foot. You're going to go in. And when you have people do this, sometimes they just kind of do this. You want to make sure they're really activating those proprioceptors. So you have a little bend of the knee. You can even go a little wider. We're going to kind of exaggerate the gait. That's maybe not quite that way, right there. A little bend in the knee, so we're firing a lot of receptors there. And then you're going to kind of turn them into Okay, now see where his head goes? His head follows his shoulders. Now in gait, ideally, this is the programming. So now this lat, elbow straight. This lat should turn off, and it does. That's normal. Shoulder up. That upper trap should turn off, and it does. And then with a guy like this, if it wasn't turned on, there's no way I'd move it. You can't really fake it. SCM on the other side. Yeah. So he's textbook. That's perfect. So I'm not concerned. His gait programming is intact on that side. Now left foot forward. Now we're going to do the same thing, kind of this way. And this lat. This elbow's got some trouble.
Yeah, it does.
Yeah. Do a little higher pacing. Okay. That's normal. Now we're going to go to which muscle next? SCM on which side? Very good. Okay. And yeah, beautiful. Okay, and then the upper trap on which side? Shoulder up. Turns. Make sure they kind of stay in the gait, position here. Hold there. And so he's textbook. Yeah. Now, come up against this wall for me. That's upper gait, what we call upper gait. Lower gait is where you can access the muscles in the lower half of the body, and they're in the inhibition facilitation. So the one I always look at is piriformis. So go ahead and just kind of stand in neutral. You can kind of lean against the wall, but bring your right leg up. Now, this should push in. This should test strong, right? It should test strong, and it does. This side too. Should test strong, and it does. Now you're going to simulate gait. You're going to do this and bring this knee up. And look at that. That should inhibit, and it does. Now, if it didn't inhibit, and we're going to find somebody who doesn't here. Try this side here. Now, there you go. Simulate gait. Push in. Yeah. So that's your textbook normal. He should inhibit. There's other muscles we could test. We could test, for example, you could step forward and bring your right leg forward. Okay. So say like that, his right pec should inhibit, and it does. Now step back. We didn't test it clearly. Yeah, see, it's normal, but if he steps forward, it turns off, and it should. If it didn't, we start looking. Dr. Francis said, look where the dura attaches. And the dura, that's where you look first. The dura attaches in the cranium. It's continuous with the cranium, obviously. I mean, the dura and the cranium, obviously. It attaches at the occiput C1, C2, and a little bit C3. And then it's just loose. The dura is just kind of floating in there all the way down to S2. So you look at the upper cervicals, cranials, and you look at the pelvis, sacrum, first. So try somebody else. Try you. So we'll just kind of do a quick scan here. What I'm looking for is something that doesn't inhibit. Now see, if you have one that's weak in the clear, like I wouldn't use that on left forward gait because, right forward gait because it's kind of mushy. So there's something else going on with that. Unless you can, yeah. So it spindles up. So there's, right upper trap. So there you go. And hold. Perfect. Left upper trap. Perfect. Okay. SCM. Head forward. Turn to the left. Hold there. Good. And now these are all good. Strong in the clear, and that's good. Now right foot forward. bend the knee a little bit, kind of exaggerate it. Now, I'm not gonna test this one because this one's, we know it's got some issues. But this right upper trap, shoulder up. Hold, hold, hold. Now, it doesn't inhibit, and it should. Kind of bend that knee a little more. We'll maybe feed a little bit more proprioception into the system. Exaggerate, hold there. No, that's locked up. So that should inhibit it, and it doesn't. Let's come back, step forward with your left foot. Now, I know this lat was good and clear. It's turning off like it should. This this upper trap is strong and clear, and it turns off like it should. This other one doesn't. So come back again. Oh, we didn't do the SCN. Left foot forward, please. And yeah, that's the right one. Yeah, okay, so that doesn't turn off either. Okay, so right foot forward where we started. And we'll just double check this. Shoulder up this way. Now it's working. Okay. But there's always that
This is
person.
why I didn't want
Okay. You're a shape
Yes.
shifter.
Yes.
Yeah. Let's try that SCM again, because maybe we can work with that. Left foot forward and left gate. So it should be this upper trap and this SCM. Forward, turn this way. And it's not. Okay, so now take this hand and TL your sacrum. So we know there's something down here we could look at. We could look at deeper. Take this hand and touch right over your upper cervical occiput. So she's got something going on at both ends where her dura attaches. Now we don't know what yet. We could try left leg forward again. We could so breathe in, hold the breath, breathe out, hold the breath out. Yeah. So we could start with craniums. If she might have. So I would go back to neutral. You'll find a strong indicator muscle, which this guy seemed to work for. Breathe in, breathe out all the way. So that's not showing that way. So it's not a big deep, it's probably not a sphenovasolar, but I'm going to ask you to touch your, actually, did you have a cruciate? Everybody got the cruciate done yesterday, but find it.
yeah.
Go ahead and touch your cruciate again. And actually with your other. So that shows, breathe in. So she, the cruciate might be the crucial thing in this case. Hang on to that, okay?
Okay.
Does that make sense? Now, that was a little, let me try one more person. Someone's gonna have an upper trap. Upper trap is fun because, yeah, it's, did you go to the game?
No.
Okay, so we'll check your last. That's intact. Upper trap, shoulder up, and over. That's not too bad. Shoulder up. That's pretty good. Okay, so SCM, forward all the way, and hold. You came with that? Again, push forward. Hold. Step forward with your right foot. A little bend in the knee. Then I go into the, there you go. Shoulder up, over, and hold. Okay, hold there.
Yeah.
Okay, breathe in. Hold. Breathe out. No. Okay, bite down. Open big. Okay, so that's not doing it. Okay, step back, take a couple breaths. Step forward again. And this time I'm going to have you use your TL hand, your therapy load. Shoulder up. Yeah, let's come up into your lumbars. Okay, let's go down to, right on the left, she's on the left SI, there it is. No, that's not quite it either. I know it's somewhere here. Shoulder up. There it is. Okay, so she has a right, okay, go to the wall for me, please. So that's the upper gate. And so we'll bring your knee up this way and hold there, push in. There you go. So piriformis test strong in the clip. Now we'll go into kind of a simulated gait pattern. Bring this up again. The lower gate doesn't turn off like it should. I mean, the part of the lower gate doesn't. Take this hand and go back to that SI. So flat hand against her. So she's therapy localizing her right SI. So she has an issue with her right SI that's interfering with her gait inhibition facilitation pattern. So hold on to that. Put a pin in that. You've probably got a right TI. We got several in here. I know if you kept them overnight. Category 2s.
I didn't know they fix themselves. That'd be great.
They can.
Sleep right.
Stuff happens.
Sleep into a perfect gait. And she's so wonderful.
We all get
Wake up
this.
fully healed.
It'd be a great way to sell mattresses.
I was just thinking, like, I want your mattress.
This is like a window into the deeper recesses of the nervous system. And this is something that everybody does every day. People walk, they bend, they sit, they chew, they swallow. These are things that are happening all the time. So a lot of times, if you look at these functions, they'll reveal glitches. Let's do one. You went. No? You didn't?
No.
Oh, I thought you were going.
I was gonna go, but sleep hit me.
Okay. Sometimes when sleep happens, you just gotta roll it. So that's weak in the clear, meaning I haven't introduced any other factors, but it's weak in the clear. So I wouldn't use that in gait. I only want to use muscles that are strong and clear. Shoulder up. This way, I'm going to pull apart. Don't let me. That's intact. This side up.
Would
Yes.
you typically like address those issues before you tested their gait? Like if you were in your practice, like if you
Like, fix the lap before
yeah,
you
like
test
fix
it.
the lap before you tested their gait.
It depends on what I'm looking for. Yeah. I might come back and make sure that, a lot of times that lat may turn on. If you have stuff up here, I mean, the lat's innervated by the neck. But it also has a strong relationship with the pelvis. So I don't chase down lats usually. When I find a weak lat, I think, remember that. Because a lot of times they'll clear out with, if you do other work. But then if then you retest, if the lat's still weak, then you might have to just do something locally to it.
It's also connected to, like, the spleen, pancreas. So if he didn't eat breakfast this morning and only had coffee, his blood sugar is probably off, which will put your lats off.
Could,
That
yeah, it
too.
could be that. And if the person's coming in, it depends on what their problem, what you're really trying to focus on. If you're mainly working with them nutritionally or maybe energetically, that might be an avenue you want to pursue before you went biomechanical.
They had shoulder pain. I'd fix it. right, if that would be part of the shoulder
If
complex.
if that was their main concern.
Yeah.
Lats are very important, but remember how much territory the lats cover. Just like the psoas, there could be so many different things that could affect it on a mechanical level. That anyway, so right foot forward, bend the knee a little bit. This way here, turn and look this way. Now see what he did? As soon as you turn them this way, if their head goes that way, a lot of times that indicates that maybe they're not used to having this. This is kind of an extreme version of the gait pattern, shoulder up. And that does not turn off. Back this way, let's have your left foot forward. And this way, shoulder up. And that one does. That one does. So something on the right, probably bring the right foot forward again. So I'm going to have him TL while I do this upper trap test. Where would I start? Where?
Neck.
Neck. I start where the dura attaches. Upper neck, cranial, and then of course sacral. So neck. Now remember the upper trap and the SCM are the two muscles that are innervated by both cranial nerves and so I'm going to have you TL right here. And kind of try to keep the rest of the gait intact, shoulder up. And we got lucky. Now go ahead and bring your hand back to the sacrum. And that doesn't seem to show much. Now, there may be more going on there, but right now we know that somewhere in this upper neck, we're going to find something that will allow that pattern to return to normal. Let me step back. So once I do that, if I'm going to chase down the upper neck, go ahead and have a seat. I think we can feather into this. This is one of the things I want to show you. Yeah, so it's do a different muscle. Let's try. That's a teres minor. I learned that down the line, but this can be a really good indicator muscle. I use this a lot as an indicator muscle. It's not a real big muscle, but it's sensitive. But if they have a thyroid problem, they're usually going to be weak because it's related to the triple number. So I'm going to have you begin and breathe all the way out. I just want to see if there's any, possible breath in, breath out change. Go ahead and put your hand over again. And remember when you TL here, it normalized the inhibition pattern. So we get a positive TL. Strong indicator muscle weakens with TL. Now let's have you go take a thumb, and I'm going to start with atlas. So the best way to TL the atlas is have the patient's thumb gently just below the ear, right where the lateral mass of the atlas is. Got lucky there again. Now I want you to, if you can, reach around and maybe this. You might have to go. No, you can't do that. Let's see if this teres minor is working good. Yeah, see that one's not. So
Well, turn on.
what's that?
It's still showing.
We could. It kind of changes. Go ahead and take your left thumb and touch your. But Dr. Whitney suggested, so I'm wanting to go strong indicator muscle as I introduce factors. In this case, we could take a weak muscle and see if it strengthens and doesn't. So, but it was this side, wasn't it?
It was,
Yeah. Okay, so. Yeah.
But strengthened.
No, it was sorry. That one weakened.
The strong indicator.
Yeah. Okay. Can you reach around? Just touch there with your index finger from the right hand. The other front. Try to keep neutral. That does make a difference, yeah. But, so something going on with the atlas. Now, I'm gonna have you lay on your back. This is gonna do a respiratory correction on that, if that's okay. You guys remember how we do that? Dynamic challenge. Strong indicator muscle weakens. Breath in, breath out, breath in. If the breath in negates the weakness, that's the phase of respiration that we do the correction on. We go in the direction of challenge on the phase of respiration that negated the challenge. I have to say that over and over again to myself sometimes. Just remember. See if this muscle is happy. And then here. That's really interesting. Sit up again, please. We haven't touched that. Boy, now that's interesting. So when he's seated, it shows on the left. When he lies down, it shows on the right. Okay. Bear with me here. Close your right eye. Okay. Strong indicator muscle weakening with one eye closed indicates an atlas on that side. It could be a lateral, usually it's a lateral atlas, but it could be rotated and lateral, but it's an atlas. It's a C1. That's, take that to the bank. Your left eye. Now, eyes open, look straight ahead, and then look up to the right. Now, look up to the straight ahead again, up to the right. I always measure twice, cut once, maybe measure thrice, cut once. So eyes up and lateral, right or left, indicates an occiput, right or left, respectively. Write that down. It's in. We've got a slide with this on it. But okay, now eyes forward and then straight up. That's good. Eyes forward, straight down. That usually indicates it usually indicates an occiput, usually a bilateral inferior occiput. It could also be a sacrum. The only way to know would be to have your eyes down. Pull your eyes down. Left hand to the right. So we're TLing, see, eyes straight down. Yeah, so it's a sacrum. So it would be probably a sacral base. But the last one, eyes to the right, straight to the right. Eyes straight to the left. He doesn't show that. If that weakens, that indicates a C2 on the right or the left. We call ocular lock, the ocular lock protocol. And we have a slide for this, and we'll workshop this. This is like, I used to teach this later in the course, but it's so valuable that
Tony used to teach it as like
Tony
the
learned
screen.
from Tim.
Yeah.
I learned from Tim. Yeah. Tim learned from David. And George. So yeah, everything rolls down here. So I want to clear his, that verified that it's on the left. And what's interesting is when I doctored TL for the atlas, it showed on the left with him lying down. It showed on the right sitting up. So sometimes you can't always believe what the body's telling you. Okay, so I'm going to go behind that lateral mass. And I'm going to press forward, just straight P to A, spring it, dynamic challenge, and I could change my vector, I could give it a little bit of S to I along with the A. Not so much. I could go, I can go a little more medial to lateral with my P to A. And so I'm gonna probably do that. I'm gonna have you take a deep breath in. Hold your breath. Okay, breathe out. Hold your breath out. Now that's different. Usually it's breath in, but occasionally it's breath out. He's breath out. So I'm going to correct this in the direction of challenge on the phase of respiration that negated the challenge, which happens to be exhalation. Okay. So I want you to breathe in. On an exhale, I'm going to pull in the same vector that we challenged. So we've got maximal. That's good. Breathe it in. And let it go. And I'm basically just pressing the vertebrae the direction I want it to go, but kind of also guiding it. It knows where it needs to be. These vertebrae know the errors of their ways when you find them. One more time. Sometimes you do it once for every decade old they are. In your case, maybe 5. Huh?
That would be 6 decades.
So doesn't Dr. T, I'll just have you stand up again. And step forward a little bit. Now, right foot forward. And like this, shoulder up, head over. Try that again. He's strong. He's really strong, but that inhibits. Now step back and shoulder up. Oh, feet square. There you go. Over. Yeah, I couldn't move him if I had to. There'd be no way I could overpower that crap. So that's how it works. That's exactly the way this should work. We were fortunate. There's probably more stuff. Let's try lower gate. Let me have you lean against the wall. Now, is it okay if I share some of your medical history here? He has 2 hip replacements. Right? How long ago did you have him?
2017, March 1st this year.
Oh, so that's fresh.
Yeah.
Wow. Okay. Amazing, huh? Bring this up, and everything in neutral. Bring it through this way. Push in. Now, see that piriformis is strong, even with that hip bend through. Okay. Now go into gait pattern. Oh, just keep it. There you go. This way and look straight ahead. Bring this up. Now that doesn't inhibit. But I'm feeling that. Can you stand on one leg comfortably? The other leg? That's pretty good. Okay. So lean against the wall again. Maybe bring this out a little bit. I mean forward towards me. There you go. Lean against the wall. Gait pattern. And bring this up. Bring the weight on this leg. Yes. So yeah, that's not inhibiting, but there's other stuff going on there. Like there's some his nervous system and muscles are trying to stabilize the pelvis. And so yeah, so that's another, there's more going on with that. So we won't use this simplistic approach on that. But thank you. That upper gate work as
So now that you fix his upper gate, and if you were to just like walk around for a bit,
oh, it'll come back.
that'd, because of that.
Yeah, I mean, it'll come back.
Well, obviously he has like a mechanical, after surgery that needs to be corrected. But do you ever find that one will fix the other, or vice versa, or you have
Oh,
to
sure.
fix both?
Yeah, no, I mean, a lot, if we left him like that, I mean, and checked him tomorrow, his atlas would probably be, would probably go back. This would probably quit inhibiting like it should. Because I mean, you're still healing there, right? It's still healing. It takes a long time. I tore a hamstring, nothing compared to what you've been through, but I tore a hamstring like 6, 8 years ago. And I'd never torn a hamstring before. I was trail running and I tore it. And I knew it was torn before I even hit the ground. Really painful. It healed up amazingly fast. It healed up in, I don't know, within a couple, 3 months, it was pretty healed. The inflammation was gone. I was able to start, doing strength training again, but I couldn't run. I'd go out on the beach and try to jog, and it was like this leg just had a mind of its own. That took many, many months of constant. I had IRT done. I did a lot of stuff, but eventually now I've forgotten I've ever had a torn. But it was probably close to a year before I could run normal because of the programming, the disruption, the programming from that tear. Tissue itself healed, but the nervous system patterned it apart, and then all the layers of compensatory patterning that my body laid on that, because I didn't even miss any work. I just kept doing life, and so my body got really good at working. Because after a while, those patterns were really deeply ingrained. They had to be unwound and deleted, I guess.
I was just curious because when he was standing, he had nothing with emotional lines. Does that happen?
A lot. Like that's why you need to test people. If you start testing them up seated, do all your tests. If you stand them up, retest everything because you have a new baseline. If you lie them on their back, you have a new baseline. And that's really a common mistake in AK. People test something and then they change too many factors that they're not accounting for. So anything even like the TLing thing is you have someone TL something, now you've involved their shoulder, their elbow, their bicep, all kinds of things have now fed into that process. So sometimes if I don't really try, if I know a person has a shoulder issue, I'll have them TL and I'll get a positive finding. Well, then I'll go and make sure there isn't anything weird there that might be.
Does metal or like replacements affect TL?
They don't, amazingly, and they often don't affect. I've got a lot of patients with knees and hips, a couple with shoulders. Once the muscles, one of the things I love working with after they get the hip replacement is to get their muscles back online. Because in those first few months after the replacement, their muscles are just like, they don't know what to do. And the brain is dealing now with this huge void of proprioceptive input, joints going. But before that, it was bad proprioceptive input. It was pain, there was nociception. So you've got maybe years of entanglement of compensatory patterns around that hip until they finally do get it. I used to think, surgery, whatever. And now I realize when people are healthy and they have a hip that's bad, that's ruining their life, the sooner they get it replaced, the better. That's kind of how I feel. And the hip, they're in and out in a day now. When I first started in practice, hip replacements were a major thing, and they weren't always that good. Knee replacements were really new when I was first in practice. Now they're day surgery. And, people are getting almost full range of motion with these modern knees. The hips, same way. People are going back to doing. One of my best friends had a hip done a couple years ago. He's back skiing. You never know.
So Doc,
Yes.
I was talking to Doc yesterday about this. So pre-surgery, I had a lot of repeated movement, right? Hardly do anything. So we're talking about getting the body aligned as much as possible pre, so that post-op, and my post-surgery, I was sparring 2 months later. Could be my range of kicking was down, but getting pre-work done, getting the gait proper as we can, post? Do you think that's?
Absolutely, yeah. Yeah, I mean, when somebody's hip or knee, hip is completely constant pain, there's a limit to what you can do. So, you might get them all rebalanced. As soon as they stand on that again, it's like, I go back into it. But the more you can keep the big muscles firing properly and healthy, absolutely. That's why I think nowadays you're seeing so much better outcome with hip replacements than we used to, because they're doing them on people who still have good muscle function. Where it used to be they would wait till people really old and really atrophied, and PT wasn't the PT afterwards wasn't always even done. So the outcomes were very mixed. Yeah, so huge improvements in that area of medicine.
Can I also say a comment? We have to remember that our patients aren't walking around with a bed strapped to their back, right? So we treat a lot of them supine and prone, but that's not how they function in the world. So like you said, when you find them in different positions, especially when you're doing pain, is like seated, they're on their pelvis, and that's why that shows up differently, right? Then you have them stand, now you put feet. Okay, so feet are gonna be huge, pelvis, and then neck. So I'll put them through all the different things, or the action of the sport that they play, or they're like, a squatting hurts my knee. So then we'll put you in a squat position, or put the different range of motion. So you have to take in all the factors. Feet are huge. We have a whole section on feet eventually, I think. But we can't forget that, because again, they get off the table and they walk around and they're gonna be like, now my neck hurts again. And you're like, well, why? And it's like, well, because we didn't look at the feet. So all that matters.
It does, and you're absolutely right. If somebody's had a classic example would be whiplash, people who get injured in a car wreck, who get rear-ended. Well, they got rear-ended in this position, Stephen. So it's very helpful to test them in that position. You may miss a lot of stuff if they're on the back.
Specificity.
Yeah.
Yeah.
And the
Now,
nervous
this
system,
slide
the
got
nervous system remembers everything, right? So like even I was in a car accident and I was bending over like this when we got hit. It was like, so nothing showed until they put me in the position. Like it was something like this. And then it was like all this stuff showed up, because that was where the like shock hit. And then we unfolded all of that to be able to find it. So you have to provoke the nervous system sometimes.
Provoke, that's wake it up.
Yeah,
Remind
remember
it.
where it was.
Bring it, I call it like bringing it up on the screen, so to speak. Same with when you do emotional work, you're trying to bring a certain flavor of emotion up on the screen so you can consciously start to work with it. This slide got messed up. Sorry about this. I think I had this in, we talked about the 5 pivot points in squatting. Remember that from last time? So we're going to go into something called plus, which is similar to the gait thing. But remember this and play with this. When you're doing your workouts, when you're doing a squat, for example, or you're even just getting in and out of a box, think about these movements. This is the way we're designed to move. And if these circles get reversed, we're messed up. We're just messed up. Sure.
This is a little bit about what I was talking to you about shoes, right? So like you have barefoot shoes, you don't have a heel on the shoe, right? So then your foot has proprioception to that. When you have, who has bad shoes on? You have bad shoes on. When you have like the heel, right? Like on typical like running shoes, that throws off that whole mechanism, because now you're in a high heel position, and now all of these muscles, like your whole gait has to change, and you end up like walking like a T-Rex. Or like girls who wear heels that they can't walk in, they're like Mandy, right? Is because you're like kind of walking like that with that proprioception. So the same thing goes when you go to like squat. If you have the thing.
You don't have to, yeah, the thing isn't happening.
Yeah, and you don't have the ability to like try to shut those muscles off.
You remember?
So then you have to compensate, like all.
Do you remember the movie The Lion, the Witch, and the Wardrobe? Yeah, there's been several versions of it made. But what's the one? The Fawn?
How do you do it?
It's kind of like that. You know? I know, I should, like Dr. Whitney was doing. So this slide got mixed up. That's supposed to be, shoot, I might have to convert. I edited this morning, but this is the version we put on yesterday. This is, the next thing we're gonna do is called plus. And so the right SCM, left upper trap, left lat, and right piriformis.
Wait, Dr. Dombey,
Huh.
should we workshop the before you do class?
Let's do it all. We'll do it all together.
Okay.
Yeah. I think that might be a good idea.
Yeah, whatever you want.
It might be a good idea, but
Great idea. This is not a good idea.
I'm gonna show this. I wish I had this slide. We might have to get this plus.
And that
Okay.
just has a list of muscles. I can write
It has a list of muscles. It's right SCM, left, so right, left, left, right. Right SCM, left upper trap, left lat, and right piriformis. Those muscles turn off when we go into about 30 degrees flexion. They also turn off when we go into about 15 degrees extension. This Dr. Fred Illy was a famous, I think he was a chiropractor. He wrote a whole lot of, when I took the postdoc orthopedics course years ago, the instructors talked a lot about his work, but he had really done a lot to map out the mechanics of the pelvis and the spine. And he found that there was this normal pattern of inhibition that happened when we went into flexion. It's believed, because the spine can't just perfectly hinge, it has to rotate. So there's a certain amount of this gait motion that happens when we just go into flexion and extension. And it's theorized that it has something to do with neonatal development, where there's like, and of course everything starts with a spiral in life, energetically, the DNA, and then eventually we're, like this. So it's kind of fun to attach some mystical stuff around it too, but someone come forth with no problems with their hips or pelvis that they know of. No? Anyone? Yeah, you tested pretty good. Heck, I don't think you had anything, did you? You were completely normal.
I was.
You were normal. You might be the only one in here. Today is, okay, have a sit. Okay, scoot back. Okay, so, these are all muscles that you guys have done. Bring your arms up. Try not to have your patient touch themselves when you're testing them, because they might accidentally TL something or hit a reflex point. You take it fast. Did you guys write those?
Yeah.
Yeah, so you guys can see that up there. Okay, so right SCM. All the way forward, all the way over. Strong, back up, left upper trap. Up, up, up. Lat's a little hard with seated, but scoot this way for me. And then hold. Good, perfect. Okay, scoot back. Piriformis. It's only on those sides, right? Push in. Right, left, right. Up. Good. Bend forward about 30 degrees. You want to make sure they're not just hinging at the hips. They want to really be flexing. Push in. Not turning off. Come on. Breathe in. Breathe out. We might have found your thing. Arch back. And push in. Yeah, see, that looks like a charm. See that?
So you're looking for all those muscles to be inhibited.
Yes.
And that's
Shoulder up. And the piriformis wasn't. Okay, so arch back. That one is. Arch back. That one is. So his extension is working good. When it goes into flexion, and I'm just going to use the piriformis up. Yeah, just like that. Actually, it is hard to test these other. Stay in the flexion. There you go. Left shoulder up. That's not firing either. Okay, SCM. Yeah, so something going on. When he goes into flexion, he's not, his spine isn't portioning maybe like we would expect it to. So where do we look? It's just like gait, where the dura attaches. Occiput, C1, C2, movement 3, and then S2. And it could be anywhere in between, but that's the first place to look. That's usually where we find it. So let's have you come forward. No, I'm sorry. Stay, bend forward, flex forward. Don't support yourself. There you go. Okay, now take your left hand and put it right over here. We're going to TL the occiput C1, C2. Nothing. Okay, now come back down and TL your left SI. And there it is. I go right on the sacrum. And on the right SI. Oh yeah, side. Big time. So it just totally turns off when we go to, so his left SI is at least as far as we know now, that's the problem. Which, save that. We're gonna have, see, you guys, and who else had a category 2?
We both had cat too,
You had cat
and
two.
then
Cat 2, so we got lots of cat
we got
2s.
lots of cat twos.
Okay, hang on to that. So his left side, wasn't it? Okay, so that's plus. We try one more person. So plus is like gait, only we're testing a different phenomenon.
So why would we test this?
Oh,
What
to
would be the
find hidden
indication?
problems. Yeah, to
Okay,
find
just
neural
like-
core.
Okay,
All of these are
like deeper pattern that you're like, something's, I
right.
need to look for something more.
Patients who don't,
Like I would assume can't get out of the chair, maybe, or like
yeah,
something like that.
yeah, but usually this is what will reveal stuff that keeps interfering with people holding their adjustments, or holding the improved patterns that you achieve with your treatment keep going. That's when we look at these, and it really has to do with dural and with dural tension. Somebody else with kind of normal, at least as far as they go, hips. So we're going to workshop this in a bit. We'll do the gait thing, and then we'll do this too. So back a bit. Do you want them? You want them dangling as much as possible. If they're, if you don't, then you have to just work with that. But ideally, like my tables in my office are kind of high. I just like them that way. So I never have a problem with that unless somebody's super tall. Okay. Now, bend forward. Yeah, it weakens just like it should. Now with plus, should the left one weaken? No, it shouldn't. With gait, depending on which leg is forward, that piriformis should weaken. So it's a whole different thing we're testing. With this is a distinct pattern. Right piriformis, left lat, left upper trap, right SCM. And it is really an efficient way to find weird stuff. So you don't have it. So let me test your gait. Well, so just stand, yeah. So he's pretty square. I mean, if you look at his posture, he's not, yeah. He's almost too tall for me to do this easily. Right there. Lats and SCM. This is one of the reasons I try to teach these muscles the first session, is because they're used a lot in these kind of things. Step forward with your right foot, please. And the knee this way, shoulder up. Yeah, that's normal. Forward. It's normal. and when you test, you make sure they stay in that, and that inhibits, and it should. So everything, and this one here, obviously the lat should be strong because it's bringing you back and giving that part of it. So come back, left foot forward. So now it's going to be reversed and shoulder up, head over. Perfect. Okay. Head down. Make sure he hasn't lost his exaggerated gait. Perfect. So, and but here's a textbook example of how both plus and gait should test. This is great to do at the end of a treatment, especially with athletes. You got all these people running and walking and doing these wonderful things themselves, and they a lot of times they have really weird patterns, and their walking is messing them up, neurologically. And something will usually go haywire, their low back or a foot problem or something, and that's how you end up seeing them. But they're just assuming that the walking is not the problem. Everybody knows that walking is good for you. Thank you.
Why is it that only one side of the body turns off?
Because of this torsion.
Oh,
Dr. Illy discovered that there's, and it's theorized it could have something to do with our ability to torsion our way out of birth canal. So it's you can consider it like a retained primitive reflex pattern. There's a lot of those in the body that are usually these reflex patterns they're neurological programs that are written at a certain time, and then they should sort of fade into the background. But sometimes they don't, and there's anyway. So that's why. So it's the gait is a normal inhibition, like the most simple example of an inhibition facilitation pattern would be this. Bicep facilitates, tricep inhibits. If the tricep doesn't inhibit, I'm like that. Or vice versa, you could be locked like that. I had Parkinson's patients who they have all of their flexors are contracted and they can't get the inhibition into their flexors because their extensors are really they're very difficult to work. I can never get into lasting results with those folks. So shall we let's workshop. We'll take a quick little break, and then we'll workshop gait and plus.
So like,
I'm glad I said something. You haven't wasted your life.
so like a hockey player, right? They're in a different position. Obviously, legs are in the turn with the stick, right? What angle they're at when it comes to drive, right? You said when they actually begin to normally fall, one might be throwing up because they're putting more effort into this position because it trains so much in it. They might be throwing up the regular functional pattern, right?
Or vice versa.
Or vice versa. I never thought about it.
Are you talking
It's like for me, right? You had to stand up and then gait like this, and you do that. And Muay Thai, I never stand up like that. I stand up like this. So I can balance a lot better. But when you had me like this, initially, I was kind of
Your nervous system is trained.
it's trained to like here, here, here. I can come here. I can.
It's like you have a mind gait.
The thing is, though, if you're doing this, that's actually against cholesterol. That's ipsilateral. So if you're doing like that kind of thing, that's way different than gait, which is like this. And I'm sure there's moves where you're. I know I've seen people. I'm not a karate person or But
And so I
I've seen people where they kind of come and they kick this.
So you open up here the chamber?
Don't worry, either of you are gonna like, yeah. Well,
It's a big one here.
so there's like, there's gate, right, and then there's like,
Ipsilateral.
yeah, so that, but that's not how your nervous system wants to go, right?
No.
But that's how you're basically saying that you have more balance, so it's like you actually train your nervous system
To dance.
to be wrong.
But you're not gonna walk that way.
No, but that's what he's
that.
asking is like,
Yeah.
if this is my sport, like, so a hockey player's inflection
Yeah.
in a gait position, how does that impact their regular gait?
It's-
Basically what he's saying, or like he's in the ispolateral, he's stronger here than he is like in the
Right, because he's trained to be that way.
Yes.
But that wouldn't, but your nervous system has to override the body's inherent. And you see people walking like this all the time. They either have no cross crawl or they have lateral cross crawl. So they're like this. I've taught yoga for 30 years, and I had, I used to do this little experiment when I had a new class. I would have them say, okay, everybody, come out in Tanasana, I want you to take a step forward. And don't just take a step forward and freeze. And then I would look around the room. 2 out of 5, guaranteed, 2 out of 5 did this. And I did this enough times that 2 out of 5 would do this. 1 out of the 5 would do this. 2 out of the 5 would just automatically go into posture. I do have them do both sides. It was uncanny. Every group had about that same distribution. And 2 of them were just, and eventually I would say, no, try this, and they're like, and after a while, they might, there'd usually be one that never really went. They had to think about it every time. And those people are the hardest people to face. They are just
Yeah, I like
crazy
people
makers.
cross crawl exercises all the time.
You can, and that can make a huge difference. But those people are, and I've got kids that I give those, and I can always, every time they come out, I say, show me your cross crawl. And I can tell if they've been doing it, because they're like, if they've been doing it diligently, they kind of go right into it, but they lose it really fast if they don't do it.
So babies who don't crawl, right, like parents are like, oh, we want you to walk early, or I just put them in gadgets, right, if they don't crawl, that's hard to like,
yeah.
I don't know why, and so even adults are like,
I didn't specify.
especially if they like,
right, left, left.
my generation that they kind of skip, they start
Not
having
in
these
this
gadgets, so
inflection
people just weren't crawling, so they never had that left-right brain connection. And so then when we do cross crawl, which we're learning cross crawl and stuff, so you can have people like do cross crawl stuff to help retrain that, which is probably would be part of your pattern of getting it, like you're really strong, but that's not optimal for even like
Yeah.
the nervous system. Versus boxing, that's opposite.
That's opposite,
Right,
yeah.
yeah.
So I was thinking like, military guys, because we do a lot of shooting platforms over here, and a shooting platform offset or isosceles here. Also, we do like ground fighting, so we're in different stance of like, we're gonna take you down, we do a boxing more. So our nervous system gets a whole wide array.
You're overlaying all kinds of specialized patterns on top of it. Basic cross crawl thing you learn at age 1. Then in your pattern.
And even then on the airplane is a different thing. You have to train your body, feet together, in talk, so you go out the airplane, when the chute opens up, it's gonna jerk you back. So you actually had to learn, and when you land, feet together, so that you can
Twist.
Yeah. Doing judo, I had to learn how to land doing judo, because you want to keep the legs open, obviously, if you're a guy, because, I've done it a few times. You know what I'm saying? So there's different things, and also when you're doing your feet. So now you're coaching, so our nervous system.
Well, your nervous system either is adaptive and can do it all, or, if you have like an accident or an injury in that, then I would say that's where you would start running into problems.
So that's what we speak to right there, like finding a guy that has an injury.
Yeah, we're good. We got a whole thing we go.
Yeah.
There's a whole thing we go.
But it would probably find with gait initially, like if it was that integrated, their gate would be off. If their gate's fine, then you do plus, right? Then you would go into the different patterns, so that's gonna get us where that is.
This wouldn't necessarily be the first thing you do, but it could go. I mean, if you got somebody who's, I mean, usually you've got a problem-focused arena to work in with those patients. But with this, it's kind of like, and you might do this after maybe you correct all the other stuff. You might do this to see how well the body functions in real time. Because balance is, I mean, there's a grip strength, abdominal strength, and balance are the three biggest predictors of. They're huge. They're like, and balance is. We start losing balance as we get older naturally, unless we're working at it. Then when it's injury, we have a lot of times retrain our body. I can't emphasize how important this is. I have my older people in my corner.
Yeah.
In the corner, I have a couple chairs here.
I don't think I ever do that.
One leg.
I see
And
it.
sides.
Well, the tea, like the
Pretty
top
soon
one,
it makes it
in the middle, like
Yeah.
hers or in the middle, ours, and people will drop into this, like,
Yeah, I don't think you get those. Yeah.
And there's a lot of capacity.
That'll take. I don't know if I can take that. I will now.
But yeah, it's grip strength, bone strength, and
my
balance.
sister
It's all
Okay.
Japanese.
So I see.
that's what
Yeah.
whatever.
It's crazy, right?
I'm well versed in this area from the Japanese side. So I could do that.
Yeah.
He has some different.
And then it
But it also,
It's a cardiologist, and he has some different things.
struggle with
Open
I
Islands.
do read it in my
Yeah.
They don't do
And like, you're like, I don't like this one. Okay.
No, I just
Oh.
told her, I was like, Dr. Higgins, like,
I'm gonna start looking at those.
Wait. I'm sure they
yeah, I know.
So I didn't have Ireland all on. But it's very cool to have.
It's a lot of summer. It's like so
It was so bad. I just was
So the bending down, I said I'm watching.
But the hardest, I do that with all my hair. Don't put it all over, like cut it.
Waiting, picking up
But then
something.
it like,
I like to people to say that because we're not like
so like the
what you're seeing.
Yes.
So now it's just finally. So,
Yeah.
not that.
You know, I think that's why it's important to not like.
It wasn't dedicated.
Something about someone who don't know.
So they get
What somebody
and
goes.
they're getting trash gear.
Also, I see how that could be a problem though.
So like with more than this, I got a majority to put like X amount of total program. So now they can
Or is it like a, what do you call it, like a subset? Okay.
Because like positive and
Anyway, but that's.
You can see over that also.
I think so.
Okay. So what is the odd?
No.
So wouldn't you just put?
I think like save some zeros in like Atlas. C0, C1.
Why am I confused right now?
No, because that's on, but. Wait, Atlas.
Why?
Oh, yeah. Just don't tell me that. You said you need like the what? You said you're used to
Atlas is fun.
Right, that's what I was like.
Yeah, C2. So yeah.
See, it says C0 and then C2, so it says it would.
Lisa, C0 or occiput? Okay.
Same thing, okay.
We were like over here like having a malfunction. We're like, we know this, but like, why isn't it? Okay.
Is it for when it's in okay, that's what he said.
No, I just had do the C0.
That's why it's not on there.
occiput.
So,
I was like, something like, look, the axis, you pivot around.
no, I appreciate it.
It's just, it's crude, but it helps.
No,
Ordato process. Like, I'm keep saying C1, C2, C0, and I'm like, hold on, let me like access all this, and I was like,
I needed a visualization.
You were ahead of me.
I didn't wait to do a prostate exam in clinic.
Why?
Because I could ace that something.
Why do you want to do one? I don't ever want to do it again. If I was on shift and
It was just very.
that is very quick.
I'm pretty sure me and Shoshana was like fighting where we'd be like, my turn.
Like, so-
He's like, I want to do something different. And if I'm gonna do this, like I want it to be different.
You don't get those a lot.
I don't want to.
I want to do
Wait,
it.
who does?
I love how there's so many to
What's
it.
Gloria?
Like,
Murder? Yeah, the series. That's what I was wondering she does.
She works at the. Yeah.
Really,
Oh, is it very often?
I mean.
Well, I'm with her right now.
I'll be so honest.
We don't do
Yeah,
that.
yeah, I go up there and I just do
That's why it's
water, wood,
That's what I was like,
fire, it's just like whatever.
just so I can like
And then
not
whichever
check
one
it.
you check it over.
Okay, I don't know. She's like.
Trying to avoid it.
Well, so do, yeah, check the
Always
state.
think
I'm
that.
not-
No,
I'm
I'm
not-
not- Okay, like maybe fire.
Yeah.
So now I'm
I was
like.
like,
I was like, what?
So like, I still want to, like, hang it out, and so the person was like, okay, I never want to see it again. Got second track.
Yeah, I'm gonna check it out. Cause it's like,
You don't like accurate?
No, I do, it's just, I
But
just think
And make sure that when I get the.
Oh, I see how that can be a problem.
yeah, it was really honest.
I can see that.
Yes, sometimes.
I was like, okay. And then I will say the worst that I
Boy, I really.
and like to get to it came out and you could see the dripping of
I would
sweat
just
on my
back
hair.
and I think it let's figure out.
Do I now? And I look at her too and make sure that she can't. And she's like, just like done. Like there was so much stuff, and she was like, so it's like it's fine, like you still need to get that done. But
Really good.
yep, it was wet, it was sweaty, it was gross.
Well, you said you were sweating so
No.
badly.
She was. I had to reach up under the second to do like the fish, and so I'm feeling it. It was just covered in liquids.
Like, was it was on your arm.
Well, the external, the internal. Yeah. It was a great time. But that was me and two electrons were on together.
Where are you going? I mean, like,
Oh, wait.
Oh, Ricky! Yeah.
oh, that she's good.
I think they're scared still, but they serve like their 10 minutes.
I finally have her. I know that's how she was my people. I'm like, so you said it better than I am at the point where like, how do you check how many you have? Go to your clinical audit, where you do super.
Like where the transcript and all that stuff is.
Oh, okay.
First visit, 3 hours.
So I just got to all the applications I had. So like, there was so many applications. Out of, well, this week will be 10, but 9 weeks. You've only seen 3 patients. No shows like crazy.
How is that even possible? Sounds great. Maybe all the people are
Or is it
South Korea.
because of the
Don't
holidays?
have that many
I get bored.
no shows.
Yeah, no, everyone was celebrating.
Damn.
Maybe that's why. Okay.
I'm adjusting.
I'm just a little bit of. Well, there are a lot of people that request her though.
She's just
Very perfect.
I think she's safe and clinically knowledgeable, but not emotionally effective.
Oh, okay.
And that's, people don't feel better and want to try something different.
I'm not doing my job.
But also, some of them are like,
Is she kind of mean? Like very like her.
And sometimes,
Yes.
I
Or
yeah,
something.
I just don't learn a lot. I haven't been taught. But some people are
because why not?
I wasn't sure. I can't stand it.
Oh, really? I feel like it's a love or hate with her.
Yeah, I did.
I never
There's
asked.
no middle ground.
Never will.
Pretty much your thing for the whole, last 9 months.
So yeah,
So, yeah, see you later.
They really, yeah. No, I feel like I had going
Yeah.
to.
That sounds very nice. I'm getting a lot of updates
I'm
Twitter
like,
are going to
crawling.
be there.
Yeah.
They're trying to get us in here early. There was like 4 of us there on my shift now.
Wow.
Before. But there's a lot of us. Yes. Yeah. Do you guys?
Yeah, well,
I know. We're probably gonna do some more primaries. Yeah, they had.
Are you honored?
I feel like they've done like 3 or 4 primaries so far.
Yeah.
And it was like a telephone. You have to like, yeah. Oh, you'll definitely get some over there.
Yeah, we're
So many of us, we have like Q13.
I'm sorry.
The Q9 but I kind of feel like, I don't know. I feel like some of us got a little bit more primaries than just I guess it was really we'll see. I know, I'm expecting more next quarter. Yeah, and you might be like thrown in. I was supposed to have a cut and off the time and there was a guy like a kid too. She's kind of busy. You just want to like go in there. And of course, shit. I have no idea what's going on with the patient, but I'm trying to get out of here. So yeah, it's fun. We're like, okay, boom.
I have 9.
So end up doing that.
Yeah.
I have Kennedy and Salzburg. You have to take me to the
I'm right. I'm ready to get out there.
If I just start
Before you were like,
like to the point where now I'm coming to like,
oh yeah, you did tell me about that. I know, it probably wasn't that bad.
like so bad.
I mean, I
almost cried a little when I got back.
so what happened?
I saw him in like college, like I don't know, let's just say. I was like, oh,
I know. And it's like,
I mean, that's like a, maybe he was just like,
well, he looked at me, he went, huh? And I was like, but I love you.
maybe he didn't know
And I
that.
was like, Marco loves you. We think you're great. Like, and so then the next week afterwards, I had to go get my glasses from him. He was teaching it. I thought I was like gonna have to walk out of my glasses. And then he started to roast. And I was like,
I think it's kind of sensitive.
I was like, no, everyone else was just I'm not sure. And I was like,
I'm between, like,
I didn't taste that. I was like, looking like here's what I have. You're making me like question my social skills. Or he was like, social skills and whatnot. He was like, okay. I gotta go now.
He was probably like, that makes sense. You probably hurt his feelings, like not like you, but the thing itself hurt his feelings. This is like sensitive.
Like I saw him during anniversary and something at school. It's just like he's so tired. He's so.
You just never know what I say.
And so everything is like, I want to learn this, but everything is like, oh yeah. And Jonathan's like, no, I just respect him.
They're like,
I'm so nervous.
yeah, just like,
And then he kind of the week and he got really nervous. He came home and went, no, I gave it to me. He's like, I felt like it was school, bro. And I was like, yeah. He's like, I don't know what it is. Stupid. It's really in my feet. I know. I was like, the next time I think you're good. Sorry.
Yeah, I was gonna even skip her home.
Stop being so smart.
Yeah.
Yeah, I feel like he's like, bring it down a notch so I don't feel like it's in front of you. I'm like, gosh. And the worst part is I'm so white, you see all my emotions.
Nobody told me the break was over.
Oh, I don't know. All right, guys, pay attention.
Hair up, we're gonna do gate. And then you're gonna do plus. Here's how you, don't worry about plus, do gate first and then we'll do plus. But test their lats, test their upper traps, test their SCM. And then have them go into a forward gate, start with right side, just easier, right side, forward gate, and test the same muscles and see if they weaken. And then have them go into left gate. I always name the gate by the forward leg side. So left forward gate, that's the same thing. If you find something that won't turn off or turn on and it's like, call us over. And then we're gonna do plus. And actually, let's do gate first and then we'll I can go over. But test all the muscles that we've been doing now for 2 sessions. Oh, actually, these were all last session. SCM upper traps.
No, he needs some practice. He's gonna hurt You're supposed to look for
Are we do we have hair?
Exactly. No, you're not over here. Never say that. I think he would. I think he'd be fine. You call what? I think he's probably used to it. I will be going. The slip of the knees. Wait, never mind. Maybe I should say that. Hi. Hey, girl. Oh, you heard what I said. That's those. Okay, be on camera. Newest reality show on Okay. Good. I felt like it was like moving. Okay, and then we need to do, he's got to get on it, that's for sure. Oh, wait, that's oh, I'm trying to put the test together. Don't worry. Okay. Oh, I gotta get in my tippy. I'm so tall. Yeah. I didn't realize how tall you were. Okay, that's the next thing. You should have it right away. You did it. Okay, so that's right here. Imagine me. Yeah. Because it has a little straight. Okay. So here, let's go like over there. So when you like sprawl a little bit. It's just okay. Okay. Okay, so you're trying to get your right foot forward. And then you're going to be like this, right? Is that right? I'm trying to get my time. So her right leg is forward. Yeah. Yes? Okay, so her right leg is forward. Okay, so this trap. Yeah, except you're cute! In my head, I was like the left. Yes, but that was awesome. Okay, we're gonna get it. Okay, right leg is forward. Well, we're on the right side. No, I'm here for you. I'm also illiterate. Okay, let's just start with the last thing here. So this should be. What? Because what's right leg? Oh, you're facilitated by the last. We're on the right leg. slides off? Oh, this is like, I really can't read. This is crazy. Oh, okay. Sorry, it's all so small. I didn't realize I was writing that. Okay. Sorry about that. From the top. No, it's not you. I promise I can't read. It's Sunday. No, I literally could not read today. Okay. No artists. It was good.
Hey guys, really quick, hold your thoughts. So just a fine point here, this gentleman is a good example. Okay, so, we were, so he was standing like this. Okay, and we did the upper track. And it's like, oh, it's not turning off. But we're not really activating, think about it, you have to activate enough juice neurologically to bring this pattern up. So make sure that front knee needs to be bent a little bit, so it's feeding a lot of noise, or not noise, but a lot of afferent into the brain. The same with the torso. Make sure that you're doing enough to actually activating the abdominal obliques in gait pattern too. There's a whole bunch of muscles that turn on and turn off when we go to gait. These are just a handful of ones that we can test. We could be testing all kinds like the pecs, the abs. Everything is subject to this pattern. So he's a good example of how we thought we had a no turn off, but in reality we have normal turn. So anyway, just one fine point.
Yeah, okay, that's good. Okay.
Okay. And then we're gonna do O. Yeah, it's like out. Oh, I don't know if that's starting out. Here's your job plan. Okay, let's try it again.
No, I thought.
See that? So small. It's not going anywhere. Okay. So is your left SC? It's supposed to be. That says what? Yeah, that was the first thing that I did. So I went in order. I started getting confused. Oh, okay. Up against the wall. Okay. And then you start doing this. All right, let me test my no other. Oh, it's so different. Okay, I don't know if that's right. Was that right? That's okay. That's just like some issues. Yeah. Okay, just stand square.
Yeah, you kind of like, so it was like.
So then, oh, right. One side or the other. Well, I think we have to know what to write. No, it's supposed to yeah, that's good to use that hand because they're in the right.
Like this, but now it's not. Cheers.
And testing.
Thank you. So yeah, the same thing that you're doing.
Right?
It's really working your brain.
There's not a lot.
Yeah. The difference is scary.
Well, you can do one side to the other side for holding, and then you can go up.
I got to chew. Trap. All right, let's get your trap. Push, push. Oh. That's crazy. All right. Yeah.
You're trying your hard. I know, because I'm like, well, it's like this, and I'm like trying to get this there, and then my arm feels like it's. So I'm like, you do your thing.
So you can also just do this, like do this and this, right? There's similarity, but like if it's when you're on your shoulder to just do that still together.
I'm so glad.
So it's like 30. Oh, this test receipt.
Oh, right. Okay.
She doesn't want to clear enough. She's about to fall over.
No, I'm trying to look at the.
Jeez. Now there's an emotion. Yeah, we're good. And I was worried I would kick you in the face. Oh, it's fine. Okay, you're ready. Yeah. I know. You want to try? I didn't ever do the other side.
Yeah, try the other side. You did it.
Let's see. We did. Right. Let's do this. Forward. So, and then if it doesn't stop, let's do bar. Yeah. Yep. Okay. So, sorry, I scratched you. I know. This oh, this is where you're sitting. Okay. Okay, this is the opposite of what it says here. Okay. Versus the shoulder. Oh, okay. So upper side, that should be off. Yeah, it is. That should be off. Okay. Your right one also. Wait, what am I here? Wait, no, it should be this one. Okay, so that regardless, they were both on. One should be off. Yeah, one should be off, but I want to say this is your. Okay, left leg forward. So the left leg, just one thing that's supposed to facilitate. Yeah. Is in the Okay, so this should be off. It should be off. This should be off. Right? No, left should be off. Left should be off. Just in everything with that. My brain's like, right, let's facilitate it. So left leg facilitation. Facilitated would be independent. Okay. So everything that's facilitated is right, like more right or left leg forward. Right? My brain's not working. I would check. Yeah. Okay, how much is this? So I feel like you're getting it. I'm getting it. You are. That's what I was like, okay. So basically, like, so you said the left leg facilitated this. So your left should be off. Your left performance that was not off. Okay, so let's try your right. I was so you got that feedback. So your like that, and then we're gonna toss your right. No, I don't remember your other side. Okay, so your right lat should be. See, now I'm strong. Your leg is right. Okay, yeah. Oh wait, yeah. Yeah, okay. So maybe if you keep this back a little bit more and I'm gonna try your other. Maybe we do, or maybe we should. Ready? Okay, left. No. Okay. You want to do awkward loss? Okay. Would you like to have some? Oh wait, you me. I almost forgot. I forgot. So what he did first, he just like tested the things. No, that's an easy step to like forget.
You can check the
Okay. You want me to? Do you want to? I did it all at once. You know what I mean? Like, tested it right here and then whatever it is. Oh, great. Okay. Everything was strong. Nope. Like this. Wait. Right? Yeah. It's like opposite. I like it. Yeah. I like it. Okay. And then you're supposed to be straight. Okay. What would you like? Good.
Okay, guys. So, has everybody switched and done gate? No, yes, no? Okay.
Switch and still doing the game.
Huh?
We switched, but we're still doing the game.
You've both done gate.
So they're still working on it. They switched, but the work kind of still working.
I was a little complicated.
You were complicated, okay. And you guys haven't switched? Okay. Okay, okay. Let's do a couple more minutes. You guys switch or do, and then, we can come back to it, but I want to go to plus. While we're all kind of loosened up, so. Give it like maybe 6 minutes.
Oh, it's supposed to be on. And it's not.
See how it's getting Wait, no, that was right. Wait. Okay.
You're kind of like,
Am I?
You're like into this weird like extension.
You're like weird. Maybe I want like that. I'm gonna be thinking about it now. I'm like, am I doing that weird thing?
Like stand up and then like yeah, to go in natural. Because you get your extension, now you're like putting a whole like thing.
I think I got it. You just push it back. Are they both off? Who's sacral? Exactly. Where
what part of his body has to
Why did
react?
that not? I don't know. Both last two.
This muscle's everything right in your face. Your life is but when you test it,
Okay, that one's good. Now I'm sweating everywhere. I know, I'm sorry. It's hot in here. Wait, what am I doing? Okay. So this way, I'm gonna be
here.
Let's think about a safe room. Whichever one's forward, right? I'm surprised by that. I'm just gonna make sure.
So what's the so both your forms didn't turn off.
I mean, you did play.
I guess I should write it down just on the paper. So now I want to see. It'll be right. So I can push straight on the face of the bigger part of the face. And then
Oh, that's so smart.
right? And then if I come down to the tip of the shape test, and push down, and then.
Yeah.
Okay, both lines.
Wait, we did only write like.
Oh shoot, I forgot. We could do it. Or we could do it when we switch. Okay. Cool, I wrote it down. I can push it better.
Other tracks are correct.
If stuff happens.
I've had mine for your meeting.
Weird views. And the worst things that happen.
Wait a little bit,
Both SCMs
but like less than half.
yeah, both Latin and
So now what I want to know, I did this protein test.
yeah.
I'm gonna assume you're trying to go over it, right? Now I want to know what they want. So I have to put one. I want all of with the breath that she makes. You can go to my school. Yeah, no.
So not the ground. It wasn't like anything. So it could be user error or like so like well, I didn't try it obviously, but I did my so
Yeah, I really did. Because I feel like yesterday, did you have an like yesterday? So I had a week. I know you had like the C1.
I think it's one that canceled out.
Oh, that's what it is. Maybe it came back.
So
What else was my last?
I don't know.
I think all of mine. Because I was like, what? All of mine is strong? And it was all weak.
Yeah. So she's gonna breathe in, straight down on the throat, and let go. Then we're gonna do that for a few seconds. So you're gonna breathe in. Out.
That's really smart.
That's like a
I feel like
Okay, guys.
hearing it again.
Time to go over real quick. We have these guys wrote up on the board, muscles up in the left quarter. Somebody sit here. Please. Then I can do plus. Your Davis first. Hey guys, watch. Sit. Scoot back. Make sure if their feet angle all the way. They're okay. They're not, no. So here's what you're going to test. You're going to test piriformis. Seated. You're going to test that strong. You're going to test the right SCM. It's up in the left corner of the board. Strong in the clear. You're going to test the left upper trap, shoulder up. Strong in the clear. And this is a little tougher because of seating, but you're going to test the lat. And that's, I'm going to test it a little funky there, but that's the lat strong. Now, you're going to bend forward 30 degrees-ish, right about there. See how she's really bent, right? I mean, we're really activating her spine. And then we're going to test the piriformis. Try not to meet, there you go. See how that goes, Pete? Yeah. And we're going to go up. We're going to test the right SCM. Weak as can be. And we're going to test the left upper trap, or inhibit it, I should say. Afraid I'm going to step through there and I hear this. Okay. So that's as normal as can be. Now you're going to arch back. Let's say, try to get back towards 15 degrees. Once again, to the side, hold there. Wait. Okay. The same thing should happen. Right piriformis, right SCM, left upper trap, still arching. You're a perfect example of this. And left arching. So that's the normal response of us. Now when she comes back to neutral seating, we're back on. Back on. It's the weirdest thing in the world, but it's like, and if these didn't inhibit, you're still in neutral. No, that's pretty good. So everything goes back to normal. So that's a good example of how it would go if everything was fine. If something wasn't fine, then you TL where the dura attaches. Sacrum, occiput, upper cervicals. Let's do that. Any questions on that? It's different than gait because it's only those muscles on that side.
So why don't you want to sit at the end of the?
Is this it where
Well, I'm gonna just so I can
Just
like kick
yeah.
it for now.
Point it at them, not us. Get at the wall.
No, at the board.
Oh, true.
Okay.
That's smart. Okay.
Yeah, the lat testing right here is easier.
So okay. I feel like yeah. Okay. So I guess we could just do both. Okay. We're not. I don't know why I get my right and my left mixed up so much. Okay.
Oh, well, that's right. We're doing left. Okay.
Yeah, that's what I just saw right, and I was like, okay.
I'm looking at that.
You really want to do it?
I don't know.
Kidding. We should.
I like it.
Right.
Yeah. It's the only way I understand how to be used.
She was like putting it at the board, so
Oh,
they
okay.
rewatched. They can right.
Check it out.
Yeah. Upper. Raise your shoulder. Okay, over.
I thought you said, where's my shoulder?
Well, I was like, where is it? Okay. SCM, right. Okay. Perfect. Okay, so I'm gonna have you like do like a weird hinge thing.
How I sit and stuff.
Okay.
I think I answer you.
Strong shoes fire.
Okay.
Hey, at least something strong.
We're trying to.
Remember just being.
I'm like trembling trying to get that thing to the middle. Okay, let's just. Yeah, I can't. She's like, I don't know what's going on. Okay.
A lot of things off.
I could just stay like that.
I was trying to figure out what was doing next.
Yeah, this is weird. Okay, yeah, I can just go ahead and do Oh, Aaron.
I got dural.
Okay, raise your shoulder. Okay.
Nice.
It's like all just like not. What if you try it?
Okay.
See if it's user error.
Okay. What the heck?
Exactly.
Wrong.
Okay, let me try it here. Let's go. What?
No, I was like,
Come here. What are you doing back there?
I don't know.
Maybe that's why. Switch your hips. Perfect. Now, yeah.
When you pull, let me have it. I want you to pull out at 45 degrees and kind of, out and forward a little bit. Yeah.
Okay, there we go.
Yeah.
I knew it was user error.
She was just recruiting, that's all.
Okay, she's cheating.
I know.
Okay, let's just try everything again. Okay, raise your shoulder. Okay, and then go this way a little bit. Okay. Are you like all the way up? Okay. What am I doing wrong?
That was hip really, so I have my shoulder up.
Yeah. What am I doing wrong? Where's she going?
Yeah.
Show me what I'm doing.
So her right SCM should be that's staying on. I'm in agreement with you. And then let's do upper trap. Right there. It's giving a little bit. Do that again, sorry. It gives. It's also very strong.
Okay.
It's not locking though. Like her what did I just do?
The
SCM
yes.
locked. Like I couldn't.
This one was like
Spongy.
yeah.
Spongy. Yeah, that one. Yeah. I feel very emo right now. And then, yeah, you look great. And then bend this up a little bit. Let me hold there. And here.
There we go.
Yeah.
Oh, so you're supposed to go like this as well?
Lift
Yeah.
it a little bit.
Yeah,
Okay, see that part I didn't know.
Really rotate a little bit.
Okay.
Oh, I didn't know that.
Yeah.
Yeah, I didn't know that either. Cool.
But SCM is strong. We don't know why.
And this one's questionable for trap.
Let go. Can you go sacrum here? And then can you go cervical?
Yeah.
She's really strong. So if you're feeling for her more so than like a bugger, which you get from a lot of people, you're gonna feel for her body not locking.
Not locking.
Yeah.
Okay.
Like when you tested that SCM, like you could sit there all day in that SCM without
Yeah, but her upper trap, you can tell it's thinking about it.
yes. Yeah. When it's thinking about it in really strong people, that kind of is SCM.
Okay. I've never thought about it like that.
And then if there's any like neurological like switching, right, or like the nervous system isn't quite like happy or sound, you'll get kind of those like iffy tests. It's about like does it lock?
Just like comparing.
You can try rubbing that out and see if you can get more of a frank like weakness.
Okay.
Because some of her muscles do really beautifully, and some of them
Yeah.
are like, girl,
Not really.
I feel like I have dementia and like I'm confused all the time, so it could be color stuff.
No dementia. No. Maybe confusion. You're just stressed. Yeah.
I don't think you're catching balls.
Oh, I was doing
Yeah, you
plus.
should. I wish we had one. See.
Try now, right now.
Yeah.
And we're trying to throw it and I'm so
Too
much
literal.
We left up the trap.
Literally the other day I forgot what I was doing and I was like fumbling. I was like,
Yeah.
what am I doing?
Do you ever have moments where you're like wanting to do something and then you're like, wait. You're like, wait, what was I doing?
You know it's bad when Jonathan says kind of it is. If John, hey man, if Venus finds
I'm
something,
mixing this together.
we're straight. We're done.
Oh, okay. So yeah,
Down.
we were like,
You're gonna try again. Okay, lean forward. So we already know your lat was good. Okay. Just not. Okay, raise your shoulder. Should I do the other side? For your left side? For left trap? Does it matter which side I'm on?
You just, no, that's fine.
Okay.
Just bring your arm over here. This. Put out this so you yeah. Let's do on this.
Okay.
And now that you did that, I was like, yeah, maybe you won't.
Okay, is your shoulder all the way up? Okay. Yeah, no.
Well, I feel like that got worse.
Exactly. That's what I was like, yeah, no. Okay, one more time. Are you okay?
Yeah, let me just like.
Okay. I promise I'll leave you alone in a second. Okay. Yeah, it for sure got worse.
Happy that didn't work. So lovely.
Yeah, and that's still like solid. Okay.
I'll leave the rocket out of the neck first.
Let's try lean back a little bit. Yeah, like that.
This is basically how it should.
Do you sleep?
Yeah.
Watch it, I'll do that.
Yeah. Okay. So we're gonna come up like this.
Not necessarily, it just means the atmosphere.
Right. But yeah. Right eye. Raise your shoulder. Yeah.
Yeah.
Gosh
Nope.
dang it.
And then you can help
It has to be my
It's gonna
opposite.
be shifted
Yeah.
laterally in that direction.
Yeah. Oh, were you like that the first time? Wait, down. And then, okay.
I am getting so but the problem is
I'm literally sorry.
but I didn't wear a shirt that is like conducive to a learning environment. Like my whole stuff is out and I can't have that. Also, I have found this out recently, but my stuff is like the small like definitions or whatever. Look at this. I don't know, it's just missing show me. Do you see how one side is higher
Right here.
than the other?
Right here.
Yeah.
Yeah, it looks like this is like all the way. And this is like, it looks like you're like twisted like that.
Can someone explain to me
Yeah, you look
how that, I mean, I appreciate that, but I would,
Yeah.
I probably would have noticed though. I was looking at like, what is it, the root of yeah, maybe it's my tattoo, honestly, this tattoo. Maybe, that's what it looks like. If I fix a tattoo and my ribs are in the same place, after we get it fixed. Well, did you guys see the baseline? Because you guys are yeah. Come back and I want to see it later. What were we doing?
Oh, everything turned off except for my neck stuff.
Okay, so
Okay.
no, yeah, I like it is hot in here. They probably have like the heat on it. Oh.
Because we're one of them.
It's like
Just like that's a great baseline.
Well, I'm also trying to say it out loud.
I mean,
So yeah. Oh, nice. It's my safe.
Probably good old cat too.
it's short. I didn't like it. I used to not wear it.
Do you think we're trying to play someone who doesn't like Trust me.
Maybe not. So those are both. Is it the oh like yeah it is. Fair point. Neither did I. But I guess for sitting, but standing, I guess it doesn't really matter because when we were doing it over there, you were already like that anyways. Do you know what I mean? When we were standing, you're already like this.
And then when we're laying down, I guess it's also lifted too.
Yeah, so that could be why we didn't really like think about that. And
Our dogs stopped like that.
yeah, we were like sitting. But we would stop by the crystal.
Oh, it was a dog stop though. Like, that's
So long.
so we could just do it. I mean, technically, right, if you're short enough that your leg doesn't work, when it doesn't touch the floor, sitting like this, then you can technically do it. But if they're just tall, then you can bring it up.
Oh. No, just like yeah. I mean, like that's you trust yourself. That's one of those like very intricate details. It's like
I wonder if it's going to be less.
I feel like sometimes it is than like that. Because I do that sometimes where I'll wear like a little like
Right.
you got it. Okay.
I'm going to try that out.
Yeah. Okay. What bend over? That's what you said. I'm like, what did you ask me to do?
Curve this back.
There we go. So I'm like hinge over. Yes.
Like,
we did this.
curve. You got to curve it a little bit. Yep, there you go.
I don't like that. Okay. What's here? What am I looking at? Flat left. Is it the left side? Right? See, yeah, we all got it. I don't know why. I love it. Change right here. So my biggest part. Wait, what are we doing? Oh. Is this? Oh.
And the thought thickens. Left and right.
Wait, sorry.
So,
Is this?
okay, we're matching. That's nice. You have a long shirt. Yeah, that's why I'm dying.
I think we're all
Pardon?
You've done one.
Yeah.
I love how much confidence you have.
I don't. I think I only do this I top is because when I go to work classes, it's 2 degrees outside. And I get in there and I sweat like it's my business. So I have to I don't know where to
Did you say a hobo? Yeah. I feel like that seems so comfortable, but I have this weird thing where I have to be dressed up.
yeah, it's too loose. I'm like,
Yeah, I don't like my clothes like moving around. I don't like they have to be painted on. I didn't even know when to have any chance of seeing any of my stress rolls.
oh, I let the stress rolls go, baby.
Oh yeah, like, I like bend over on here.
Like if you're looking at not working,
That's
mind your own.
literally
Mind your stress rolls.
I think that was pretty cool. Mind your stress rolls. I'm sorry, I'm feeling very nervous. Now because he said, so what did you say about your so you can get nervous system. So now you're gonna I don't know, maybe that's a I also flip. I can listen, but I know I
Okay.
Right? And so we're going into directions because when she breathes in, she takes it with it. Right? So there may be the one that so,
I'm doing better. Yeah. I thought so.
going this way, she's gonna take a deep breath in. And then she was back.
It's such a valuable
Yeah, it's all ones.
Very nice. One more time. I can really belt it out if you need.
Hey guys. Okay, we're gonna do one more thing. I'm gonna teach you one more thing. Workshop that, and I think that'll take us into lunch. A lot of you had category 2s and sacrums that you found with the plus and with the gate, right? There's several, I think, that we saw around. So we're gonna be hopefully addressing several of those things with category 2 after lunch. But first of all, I have to bring the slides back up. Could you, we actually don't need to. These guys drew it out on the board really nicely here. That's really, who drew the eyes?
I know the
They
name eyes.
eyelashes. So ocular lock, and I'm gonna have somebody come up so I can, somebody with a fairly healthy upper neck, yeah. Now, let's see if I can find a slide. Go back. Well, some of these are worth going back. Oh, shoot. Wait. All right, it's probably at the very end.
You want me to find it?
Yeah, find ocular lock. Okay.
There it is.
Okay. So in AA, you've been around many AAers, you hear this term switching a lot. Oh, he switched. Oh, you're so switched.
Oh,
And that's the old term for what we like to refer to now, which is much harder to say, is neurological disorganization. So sometimes you test a muscle like we did with you, where, and that wasn't maybe switching so much as we did. His atlas showed on one side seated versus lying down, and then we finally did some more checks, and we ended up correcting it and it cleared. Well, then later he was doing the plus, and it revealed it was on the other side. It was still out, or it had come back. Yeah. So those kind of things can be, sometimes when you test and the body seems to be throwing your curves, it's because the way the body is organizing all this input is kind of skewed. So the body might show a weak deltoid at one point, and maybe next time it's the other side. Maybe the problem is really over here. So we call it switching. It can be crazy making. The most surefire way, I'll show you several ways to clear switching. I'll show you several ways to find it, the way I do it anyway. But this is probably one of the most powerful tools I've ever learned in AK. And this is what we call ocular lock. Now, when you look at ocular lock in the blue book, it's a different thing. it's a valuable thing what they teach in there, but that was before this was developed. It's based on the premise or the anatomical reality that the eye movements are interwoven with the upper head and neck. So if we're looking with our eyes, our neck and our occipits C1 and C2 are doing all kinds of very specific movements. So the suboccipital muscles, the ones at the top two vertebrae, the rectus, capitis, posterior major and minor, the obliquus, capitis, if you remember those, superior and inferior. Those muscles are very finely tuned intrinsic muscles that are wired into the visual neurology. So when we move our eyes to the right, there's a very distinct pattern movement initiated in the suboccipitals into the left and so on and so forth, up into the right, up into the left. So it was discovered that if a strong indicator muscle weakens with certain motions, straight to the right, to the left, up, whatever it might be, it indicates a certain kind of subluxation that could potentially be there. So it's a very quick way to clear out stuff that's causing the body to be just somewhat confused, or less often, neurologically speaking. This is the pattern. This is one of Dr. Tim's slides. I got it from Dr. Rob. But this kind of spells the whole thing. Now, I was using this on some of you to kind of verify what you were finding with some other TLing and stuff. And same slide? Sitting there twice. I don't know.
Just making sure you did this.
Yeah, it's a really good slide. Okay, so the first one, so all of them involve eye motions except the atlas. And the atlas is having one eye closed. So, first of all, find a strong indicator muscle. And now, say I had done, or one of you had done plus. Did you have anything on plus that was weird? You did, didn't you?
Yeah, but we fixed it.
Okay. Say the person fails plus. They don't inhibit like they should. They TL to the upper neck. Okay, now you know you got something to look at there, but you don't know what. You know something in that area. So you have them go out of the plus, out of the gate, whatever you might be using to get there. Have them sit in a neutral position, find a strong indicator muscle, make sure their eyes are looking forward and open. And then I always have them close their eyes just in case there's something weird going on. Because a lot of times people, if they're really, renals are really wacky, if they're really, they're not getting enough sleep, a lot of times you have them close their eyes and they just blow out. Other people, they might be, if you have them close their eyes, things turn on. It depends on how the nervous system is being overloaded. So, that one was. Yeah. Okay, now close your right eye. And close your left eye. That's good. Eyes open, look to the right. Sometimes and they want to turn their head like that. You just want to isolate the eye movement. Maybe you really fixed you. Oh, there it is. I'm just eyes to the left one more time. I always measure twice, got once. Eyes up and to the right, which is going to be occiput on the right. Wait, are you up to the right? Yeah, way up, right. Eyes up to the left. Occiput on the left. So once again, look straight ahead. Sometimes I get my baseline back again. Eyes to the left again. So her C2 on the left and eyes up to the left. Her occiput seem to be causing an issue. Now eyes down to the left and down to the right. Eyes straight ahead and straight down. And straight ahead and straight up. So she's got questionable things happening at her left occiput and her left C2. C1 doesn't seem to show, but I can feel her C1 and it's kind of like over here. So, you guys are surprises. Yeah, so there's, have you had your upper neck injury? You ever had, excuse me, head or neck injury? Now there's something going on the left. Now I'm going to slacken that tissue. I'm going to move her around until that tight suboccipital muscle just feels sort of soft here. She's way over that way. But now hold there. Straight out that way. I want her eyes looking still relative to her head. Hold there. Close your right eye. Close your left eye. There the atlas shows up. The atlas was hiding from me. It was showing C2 and occiput, but the atlas is really, I can feel. That's why you always want to do these and then palpate it too. Whatever information you can obtain is going to be helpful. So her atlas is posterior on the left. That's what it feels like. And her rectus capitis posterior major is tight. So I'm just going to do a little muscle work here. Okay? Because she's probably had this adjusted in the past, right? So I'm doing like basically myofascial, like micro myofascial release. Just kind of pinning the muscle and, yeah, sorry. Now we'll see what that changed. Okay.
Yeah.
Okay. Look straight ahead. Close the left eye. Still, that didn't show in neutral before. Close the right eye. Nothing. Okay. Eyes to the left. It doesn't show now. Doesn't show. To the left. Eyes up and to the left. That's still there. So the occiput is still. So that's what we call ocular lock. What you do is you find these things, or you're pointed in the direction of these things. Go in and you TL, you challenge, you use, and like I'm choosing to just do some muscle work in here. I could just go in there and just open it up, but I don't really want to do that. See if this will do it. Okay. Now I'm kind of milking that muscle too. I'm still kind of myofascially releasing it, but I can already feel it's kind of got some fluid moving in there. Now you wouldn't do that with an old person with arthritic neck and vertigo. You wouldn't. You know that, right? You'd end up with a complicated day. Eyes up and to the left. Eyes down to the left and down to the right. You still have that. Now touch your right SI down to the right. So her TLing that right SI negates that finding. So that would lead me to think that she has a category 2 on the right. Everybody's in here, I think, has category 2. Questions? Ocular lock. Now, please, if you find, if this is, don't do this. If it goes to the right, oh, C2, don't go yanking on their C2. If you find something, go in there and TL it. Use your palpation skills. Have the patient TL it. Play with that, and then call one of us over. We can look and see. Sometimes a lot of these will clear out without a lot of fanfare. But I've had this in the past where people are really oversell. Oh, that's a C1. Okay, oh, that's a C2, and the next thing you know, they're just rattling necks all over the place. And I'm not licensed in Arizona, so if I do any adjustments on you guys and it goes south, I never knew any of you. I was never here. I have a whole other identity. This is not even my real name.
Yeah, it's recorded.
I've never been to Oregon in my life. All so, you guys want to workshop this?
Yep.
Now, which muscle would you use? A strong indicator muscle. And you can use any muscle that you want that you know something about, which is, of course, delts. You can use upper trap. You can use any of these muscles.
Are you coming to make to the front to make a formal acknowledgement? You're going first. Okay, we'll try delts. Beautiful. Am I supposed to sit? Okay, I think that was kind of, if it was relaxed, it was gonna go. Yeah. It also supposed to be while you're like down here. Oh, so but it's fine, so it's fine. We're okay. Okay. Head straight. Everything's moving. Okay. Okay, close your left eye. Close your right eye. Yeah, so the closed one, that's like left eye, right eye. Yeah, okay. Close right eye, close. Okay, I'm gonna do sacred. Because why the heck not? So, straight forward and then up. Yeah. Oh, okay, straight forward and down. So doing this? Well, you could do down. Yeah, okay. Yeah, let's do okay. Girl, keep your head straight. Okay. Down and to the right. Okay. Down and to the left. Yeah. No shot. Okay. Okay, try the other one. Okay. Well, we thought she has. We know she had one that had two the other day, but we found. But then both of the like down and sacred and up didn't show. So we're gonna keep trying. Yeah, just do. Also, like, to your look to your left, straight. Midline left. Right. I really want to move my head. Okay. We have to the up and to the right. Okay. Up and to the left. Hey. Okay, occiput, left occiput. That's about all we got. Which is that's actually good though. Okay. Yeah, tail it. Okay. Everything is relaxed. Girl, you arching your back. Why are you arching? You can't like straight. Oh, that's just gonna change it. What? You don't know how to. You can't. No. Oh look, it's like a replay. She's like, oh, like this, and I'm like, look, this is gonna change it. Time? No. I don't think so. Time you have to add in the flare. That's okay. Okay, what about now? That works. Good to me. That looks good to me. And resist. Hey. So does that mean it's twisted? Like that? Well, you were just touching it, TL. You didn't. Did you put pressure? No. Oh, okay. I was like, girl, it didn't look like you doing pressure, but that doesn't mean you didn't. I don't like having this right next to me. He's gonna hear my voice. No one needs to hear that. Listening to us this whole time. So sorry, guys. So, I've actually also never tried. We could do. So, can I just do it on your head? So you could do like up, down. That's why I was like, I wonder if it's like twist it this way. Because you could do like twist it that way. You could try twist it that way. You could try it like that. Did you get any of that? Yeah, but okay. I was just gonna do the one side. Can I just do? Well, that's what I was like. I wonder if it's like twist it like this. Well, then if it's the nice
me. What showed up? I don't know why I'm like inserting myself, but I don't even know.
Well, because it was an opposite thing. She was like, I can challenge it, but I don't know what to do it. So I was like, I used to down.
Yeah, you can go to like your school file. So there's just like one side of your one side of your number, and you can right.
Yeah, so just do like, you can do static. Yeah.
You can do
Just
static,
like
okay.
or whatever.
It's hard. Yeah.
I thought, well, that's why I was like, you could just do static. That makes it easier.
Yeah.
And then,
Turn around, I got you.
Okay.
Okay. I also wanted to box it.
Oh yeah. Oh, you're yeah. Do you really have to like I it's really good. Sorry.
I was listening to it.
Yeah, I
Hey, Dr. Downbury.
whenever you're done, can I get your hand in I can try it.
I'm trying to work on my palpation skills, and they're not very good. I can feel but on the left, I really like it. But
It doesn't have a little bit of everything. Whatever you need, I'm happy to oblige. So where are you?
right by the school.
Okay, so I want you to hide.
I don't know, Lori don't know how to palpate it.
Oh, actually, okay.
You also a lot more sure.
Probably, because I want to see. So part of it is just feeling tissue, but then if I want to feel the actual strain in the joints, I gotta be a little more aggressive. A little more.
So,
So,
right now, it doesn't actually like that.
Because if I push and let go, I do not stop. Straight, so that would be like when you're around your desk, whatever you want to do.
I'm really trying to
No, I am.
I gotta work on fast thing. Okay. Yeah. Let's go.
What did we find out?
I still don't know what palpate, so I thought it was like this.
Okay.
I was like,
What about conduct?
And then you have to test it. That's what I was. That might have been what I was talking because I like tried to.
Okay. Oh, I see, like this, okay.
Yeah. I'm working on that.
Did you challenge it? Like, on the side that you think is dropped, did you try to push it up and see what happens?
Just your, or that. And I think it's a push up.
Okay.
So we'll because we know it's TL.
Yeah, and then you pushed up and it went strong. So that's where it wants to go. Like, if you push on the other side, it's gonna be good.
But you can just go just for like. And you kind of down this way.
Yeah.
Or like pulling down. What do you mean? So sometimes what I'll do is I'll like try to twist it like so if you think it's like this, you can twist it further like this and see if it's weak, or twist it like that. See if it's strong. So you're doing both. I'm just doing both. Yeah, I usually try to like try to twist it. So like if they're like you can just test like algorithm. Yeah. Do I need to test to see if it also works?
It was right. Are you a seller now?
I would just
Yeah, I'm like.
I did last week. I was like talking just to see.
Yeah. Oh,
And then I don't think I keep doing.
yeah. Can you, can I see it?
Yeah.
Yeah, sure. Okay, so I do.
Tell me.
Oh, I see it. Okay, gotcha. No, I don't like that. So it's like awkward. I can never.
I wanted to make sure you.
Yes.
We found something.
You did.
I put it on
But,
So this is what the challenge. We only did push and that made it stronger. Watch it for the yeah.
and then you're right, like that. Just got on your right down, and then turn from here. I just want you to like
Let's put on the left and then we must challenge it and push up. And then we also just do it further.
Yeah, yeah, and if you need to bring the table down, like I'm shorter, so I need a smaller table. Yeah, yeah. I have no idea. Yeah, yeah, but yeah, you just need more leverage.
It doesn't feel weird to do it.
Okay.
So like, where do you? I know this chair is too.
Yeah.
And you felt it.
Now, we can walk across it.
Okay, because those are the things that. Did you try what?
crazy.
Yeah. Hey guys, freeze frame what you're doing for just a second. Everybody switch with ocular lock. Everybody's done ocular lock.
We're not quite done.
Okay, you're in the process. Okay. Here is a really good example. I just want to run through this one more time. What do you do when you find it? Now, you could have entered into this process from a number of different ways. You could have tested gate or plus or something and saw something, and then you might have gone to this to see what exactly you need to correct. That's one typical way that you use it. So strong indicator muscle looking straight ahead. She goes up to the left. She goes weak. So that is occiput on the left, likely. She goes straight to the right. She goes weak. That's C2 most likely on the left. How do I know? Then I can go back and I can challenge her occiput in the same position, just like I would have dynamic challenged her looking straight ahead. And I get a verification that it challenges, it's a positive challenge, dynamic challenge. I can do the same thing with C2, come right off the occiput and put a little bit of a challenge through that vertebrae. And so then my next step would be, if I was going to osseously adjust it, I would kind of know my vector. But if I was going to do respiratory, I would do this. And you can do this at the same time if you want. Challenge, challenge, breathe in. Hold the breath, and it strengthens on the in-breath. Breathe out. Hold the breath out, and it goes weak again. So you can double check yourself, make sure your indicator muscle is coming back. There it is. Okay. Now, same thing with this. I'm going to challenge the C2. Breathe in. Hold the breath. So both of them appear to want to be corrected on the in-breath. So I would do C2 first, usually, because it's just, I typically would do it first. Because occiput is sometimes hard to adjust if anything else is bound up. Breathe in. And I'm just rolling C2 around. Now remember, C2 glides on C3. But C1 pivots C2. 50% of cervical rotation occurs between C1 and C2. The rest of the cervical rotation occurs between all the other, due to their gliding, the facetal gliding, shifting. So that's where I'm kind of keeping that in mind while I do the correction. Now I'm going to see, maybe that'll clear the occiput. Hold there. Eyes up to the right. And it's not really showing. Eyes straight to the right. When I just corrected, seems to be clear. Eyes up to the right again. And then breathe out. Yeah, no, I still need to do that. It's sort of a subclinical one. So I'm going to go back and I'm going to challenge. Deep breath in. Hold your breath. Okay, good. Same thing. Inspiration assist. That's what they usually are, except for somebody this morning. You had an expiration assist on something. Breathe in. There you go. Now I'm kind of rocking her occiput. If you think about the occiput sitting on the sets of C1, it's kind of like a ball in a bowl. Okay. I'm just feeling for that as much. I'm trying to concentrate the motion without giving her too much of a cranial problem. Up to the right. That seems to be good. So that, hopefully what you're finding and doing, that's how this works. Now, oh, I know, and we didn't, so when you look straight down, that's go straight down to the right, straight down to the left. You had that before, right? You had left, seems like something left TL there for me. So you're looking straight ahead, right? Okay, look straight ahead. So if you TL to back up your finding with the ocular lock, make sure their eyes are back straight. Otherwise, you're still triggering the ocular lock. Sometimes I forget to do that. But, so if she's down and left, we get a positive finding, right? If we come over here and she TLs here, down and left, that negates the finding, negates the weakness. If we take that away, bring your eyes back straight in neutral, and touch here again, now we're getting a straight therapy localization. So it's just a way to kind of step back and so now we know, just like with the ocular lock, and then the TL and the challenge, and then the breath negation of the challenge told us how to adjust these two. The same thing's going to happen here. We're going to find it. Use the same process, I guess. This is a brilliant. Everybody uses Dr. Whit, we were talking about. She doesn't use this too much. She used to. She's got other stuff she does. I still use this all the time. I use it in various ways to, especially with new patients. A lot of times, I want to see how switched they are neurologically, how neurologically resonant they are. Sometimes they're pretty wacky, especially if they've never been to somebody who does 8K. You really have to educate them. They have no idea what you're doing. It all is confusing, and their body, the nervous system is confused. And so their conscious perception is also confused. So then you've got your work cut out for you. So things like this will blow their mind. If you're trying to kind of really get them in your corner with muscle testing, a lot of times they're skeptical when they come in, their spouse drug them in, and so if you can find something, these are really clear cut. Everybody's got upper cervical stuff. So a lot of times this stuff will show, and it'll weaken a strong muscle and strengthen weak muscle. You can do it from weak muscles, but then you always want to back around and use a strong muscle. But it'll blow their minds. They're like, what just happened? And they can't believe that the muscle went strong and then went weak. So it's a nice, efficient way to kind of break them in fast on 8K. And then sometimes they don't get it. They leave going, they have no idea. They're still confused. Talk to them the next week. I don't know what all that was. So that doesn't make any sense to me. So then you have to kind of.
Well, my neck feels better.
Yeah,
So,
it
like,
feels
so I
better,
came
but
back.
they don't. A lot of times they don't want to understand it, so they just chalk it up to magic. It's just magic. So that's fine with me. Anyway, so that's a good example of how. Now let's see if it helps. She hasn't done anything. Stand up and jump around. Challenge your stuff. Just walk around. Yeah, just cross crawl. Gate motion. Take a little hike. Because we didn't fix the SI, right? We didn't, or whatever that is. Sacrum SI, something going on. We didn't fix that. We'll fix that here in an hour, a couple hours. Okay, so let's just double check. Was that very closure? Oh no, eyes open, look up. But that's good. Eyes straight and then over this way. So I'm happy with that. Now go back and TL here again. And that's still there. So that'll be a category 2 probably. Everybody's going to get a chance to fix a category 2 because I think half of us have them. Maybe all of us have them. And so, so we have. Do you guys want to do lunch at noon?
Yeah. You can do whatever you tell us to do.
I would probably skip lunch if somebody didn't stop me. And then I'd be famished later. Why don't we see? Let me get through this group of slides that we can kind of lay them to rest, and then we could.
I don't know. I think she's still probably in the like wellness week. How do you push her out?
Is there enough of that?
Like, how does what if he did this? Push me like he did.
wish it was that way.
So, you know,
I was just using one. I'm just gonna. I'm not gonna hold your dinner. You know, I'm not gonna eat it, so don't worry. I guess I could have done it.
I always worry about you.
Don't worry about me. I need
Oh, I have.
Because I was like, this was so instant.
what?
Yeah. But.
Yeah.
All right.
Yeah.
okay, guys, let's run through these slides. Just to kind of reinforce. And please ask, if this is confusing, because it wasn't the first time I went through it. If this is confusing, please ask, because you're not the only one, I guarantee it. Some of this doesn't make enough sense for you to be able to take it and use it. Take cohorts of your patients if you're doing that, or your family members, whoever will sit still long enough to let you try this stuff. Any questions before I? Stop me if you need to know more about this. Okay, so this is the one you can print off and laminate and use, in your practice sessions. This down here, base posterior sacrum, Dr. Francis came up with that. He actually came up with the whole thing, but not the whole thing, but this was really his contribution, and he actually was the first one to start teaching it a long time ago. So the one eye, okay, so bilateral inferior occiput is both eyes up. You find that pretty often. Don't adjust that first, I'm just saying. If you find that, note it, and then go to the other ones. And I would probably do C2 or 1 first, if you found like more than anyway.
Only find that one.
What's that?
What if you only find that one?
Then you only do it. And I would do it very gently. I can show you how to correct it by that. There's some really violent adjustments people do on that just make me cringe. But it's not a hard one to adjust. Now, if you don't normalize the function of the neck flexors and some other things, and weak abdominals and all those kind of things, then you can fix that. It's just going to come back. One eye closed is an atlas. So all the others are eyes open and moving around, but the one is the atlas. For one eye. And a lot of times you can actually, if you're holding the lateral mass of the atlas gently, and you haven't closed the eye, you can actually feel this shift. It's really weird. But that indicates that you've got usually a lateral atlas on that side. So a more traditional approach to what was thought of as switching in the old days was to rub.
Does it matter which eye you close?
Yes. You close one and then close the other. And if you close one and it weakens, that's going to be your atlas. Now some people can only close one eye, and when that happens, do the best you can. Sometimes if they can't close one eye, I'll check the other side, and if it shows, then I'll go ahead and correct it. But sometimes I have to have them just gently close. And then if that doesn't work, then I go to just normal palpation and challenge. Yeah.
Do you think it would be possible?
It could. I don't think typically it does, but if they have a lazy eye, or they call that strabismus, where one eye, where their eyes just aren't tracking, that can certainly.
No, strabismus. Are you talking about if it's like closed and it moves? That's strabismus.
Yeah, like a wandering eye or a lazy eye.
Yeah, that's strabismus.
Wandering eye is a whole different thing. A lot of men get in trouble for that.
That's why you started talking.
So traditional approach to switching is you have the patient hold K27 see if they weakened it to holding K27. And then you'll have them hold, and if they do, you can have them, you'll put one hand on the umbilicus and one hand on K27. CV8 is just right below the umbilicus. And you just rub those for maybe 30 seconds. Okay. And then usually the other side, usually just do both sides while you're at it. A lot of times that will clear the positive K27. This is an old, that you will be on your test. So understand that, and you can check it out in Walter too. That's the description. So K27 switching is called.
Oh, okay.
So make a note of that because this will be, there'll be some question on test, I'm sure, about. Another way to clear this, if somebody tests positive to bilateral K27, is have them cross crawl. Cross crawling, of course, is used in all kinds of professions for all kinds of things. Eye issues, coordination issues, right brain, left brain stuff. Like I was talking about earlier, and I do this with patients too, but when I have somebody just do this step like that without thinking, and they automatically do this, they need cross crawl. So they leave the office with some instructions to do. And there's this stuff here that therapists have people, and I think there's a lot of value in that. I would rather have people look straight ahead like they're walking and do just an exaggerated march. Because this is what they're going to, you're wanting to train them in their walking gait. And so you want to train them more like they would normally walk. People don't walk like this. Not that that's not a good cross crawl. I really think it's a good one, but once again, this is so important in gait, and I think often overlooked. This movement here, and this is where K27 is. So every time if we're walking properly, these major proprioceptive gatherers of information right here are sending really good signals in the brain to help the brain know what motor signals to send next. So cross crawl. And honestly, with like your younger folks, a lot of times their nervous systems just never quite learned how to cross crawl. And a lot of athletes, it's amazing how many athletes I've worked on, young athletes who cross crawls really crappy. I have a kid right now, he's 13, 14, 13, baseball player, catcher. And he's been growing a lot, and he's just wacky. He can't do he's just all over the place. He's a good little athlete, but his coordination, his centralized coordination is really in need of improvement. And of course, being a catcher, he's not doing cross crawl, right? Anyway, so rubbing out those points, cross crawl. If somebody tests positive, have them cross crawl for say half a minute or a minute, and then test them again. A lot of times it'll clear it. This is some of the old Olay case stuff that started like in the early 70s. And Dr. John Fee, who's long dead, he's the founder of Touch for Health. Some of you have heard of Touch for Health, I'm sure. Touch for Health was a lay version of John Fee, who's one of the original diplomates, Dr. Goodhart. But so in the early, I have a copy of a Touch for Health book. I think it's from like '73 or something. And it's got all this K27 stuff in it. So what causes neurological disorganization? Anything. Stress, biochemical toxicity. Some people are very sensitive to EMFs, and some people are dealing with Emotions can switch us. Allergies are really notorious. People who have significant food allergies, it's always switching them. They do fine, and then they have dairy, and then their whole dural torque thing comes back. If you're good at making them understand it, then eventually they might quit things that throw them off. These are some traditional nutrients for switching neurological disorganization. RNA is our standard process has an RNA. Dr. Goodhart used to use this a lot when he felt like people were logically off. He'd give them RNA. It's supposed to help kind of wake up the brain. The Antranex is a really, I don't use Antranex at all. Antranex is a standard process. It's probably one of my favorite standard products because I don't use a ton of standard. It's not an antihistamine. It's a histamine soaker-upper. So when people are having these kind of chronic inflammatory and all this extra histamine floating around from whatever it might be, whether it's pollens or dander or whether it's something they're eating, Antranex seems to really bring that histamine activity down. It's amazing how well it works, and it's made from some mushroom. Some kind of mushroom. Of course, this is a whole other subject. You know, your folic acid B12 stuff, your methylation. You guys are probably way more up to speed on that stuff than I am. But the methylation problems that have been sort of, I don't say invented, but no, really revealed and discovered in the last 20, 30 years. MFHTR problems.
It says it's bovine liver fat and bunny.
Antranex is?
Mm-hmm. Bovine liver fat extract and D-alpha tocopherol.
Why was I thinking it was made from a mushroom? I must be confused.
Cal lactate, cal stearate.
Wow. Now you can't believe anything I say.